Hi, welcome to the channel. This is Green Tree Farm and we have a special video for you guys today. We are launching a natural health series with Dr. Jocelin. So thank you for being here.
I'm excited.
Yeah, me
Thank
too.
you for having me.
We've had this on the books for quite some time, but we've had just different things pop up and it just hasn't happened till now.
Yes.
So today we're going to give an introduction to natural health and she's going to share some insights on what a naturopathic doctor is. Why don't you start off by telling us a little bit about yourself and how you got into all this?
Sure. So I was 6 years old, 5 to 6, and I started having chronic bronchitis. And I went from child dose antibiotics to adult dose antibiotics to steroids. And I would be sick for 2 weeks, I'd be well for 2 weeks. And then I'd get sick again for 2 weeks, and I'd be well for 2 weeks. And all my mom wanted was for me to be better. And she saw this progression of how I was having to have stronger antibiotics, and then they were introducing steroids. And she had a friend who had been trying to get her to try out an herbal blend that was great for lung and respiratory health. So she finally said, you know what, this is getting to the point where it's getting concerning, and the pharmacist had warned my parents about the dangers of the steroids and the amount of medication I was on. And so she said, well, let's just try it and see what happens. Mm-hmm. So I started taking the lung blend, and I went through, do you remember those old boxes of Puffs tissues when they came like 244 count? Yeah. I went through 2.5 of them just getting the phlegm and mucus out of my lungs. The antibiotics were killing off enough of the bacteria that I would feel well for a couple of weeks, but then I wouldn't be able to maintain it because all that mucus was still there breeding the bacteria.
Oh wow.
And I got it out. And I didn't go back to the doctor until I was 16 years old. And my mom really wanted to know for sure that I had chickenpox at 16. So I think my only other visit has been related to pregnancy. So I would say that's probably a pretty good track record.
Yeah, I think so.
But I graduated from high school. I was homeschooled, and I love to study. We always had herbs in our home. We used them for different things. I worked in the Christian financial industry, working for a Christian ministry for about 4 years. And when some things changed with the ministry leadership, I was like, okay, what am I going to do now? Where am I going to take this? And my mom said, well, you've always enjoyed herbs. You love studying. You love helping people. Have you thought about getting a degree in natural health? Mm-hmm. Well, I tend to be a bit of a studier and maybe slightly an overachiever because I didn't get just one, I actually got 6 degrees in natural health. So I have to use my fingers to keep track of all of them. I have Doctor of Traditional Naturopathy, Doctor of Biblical Medicine, Certified Aromatherapist, Certified Nutritional Counselor, Holistic Health Practitioner, and Certified Chaplain in Holistic Approaches. And then I'm working on finishing out my fertility coach certification right now before eventually getting my PhD in naturopathy.
Wow. She's busy.
So, and then I have an active practice where I see clients, as I call them, and I have my own line of essential oils, which is what we're sitting in front of. And my husband and I and my parents have our own health food store.
Awesome. Great, you're busy.
Yes. So a naturopathic doctor looks at the body as an entire being. The Lord created us mind, soul, spirit, and body. So you look at the body as all interconnected. It's not just a symptom of high blood sugar that we treat, but the body is in distress and actually giving this symptom off because there's underlying immune issues, there's underlying gut inflammation, there's underlying issues. So when you start digging at the root, it's just like when you're out in the garden and you're trying to get rid of the weeds. If you pull the top off, that's great because you no longer have the weeds that appear to be there. But if you don't get the root, it's going to keep coming back and coming back. So naturopathy takes the approach of we have to deal with the underlying root of what's going on with nutritional deficiencies, what's going on with lack of good food, lack of good water, lack of exercise, and how can we support the body to be as healthy as possible and thereby reduce the symptomatic effect. Well, you cannot legally use the term treat or diagnose. However, the body tends to tell us a lot of what's going on just by the symptoms. So I can tell people that their thyroid is showing that it's in distress. So let's use some nutrients to support the thyroid. Of course, people will come to me a lot of times already having a diagnosis from a traditional doctor, and maybe they're frustrated with the amount of medication they're having to take, or they don't feel like they're really getting to the root cause. Or it's, okay, well, I'm on this medication now, my doctor wants to add another one. And so I'm like, well, let's start digging in and start supporting the body so that we can stop this snowball effect of symptoms continuing to build.
Yeah.
Because a lot of times you start with one diagnosis, and if you don't deal with it, let's say you're diagnosed with something in your 20s, and you don't deal with that diagnosis, you probably are going to end up with anywhere from 3 to 10 diagnoses by the time you're in your 40s and 50s.
Wow.
Yes.
That's a lot.
Again, those roots out of our gardens or our bodies.
Makes sense.
I graduated from New Eden School out of South Bend, Indiana. Got all 6 degrees there. My fertility coach certification is through a different school that specializes in that, and then I'll return back to New Eden for my PhD because they do offer that. I was very privileged. Our professor and school founder had 35 plus years as a naturopath, and he was also an educator for a top supplement company. So he has a lot of experience in the field, and he doesn't take many students on, so I was privileged to get my clinical hours, over 400 of them, through him.
Wow.
So then I never stopped reading. You know, that's the thing, is whether it's an informational pamphlet from one of the supplement companies we carry in our store, a new book, an online article. Of course, you have to be careful what you read online.
Yes.
You can get good sources and bad sources.
Yep.
But then, you know, even what is the medical community saying? What new research have they done? And what's the drug response? And what can we support the body with naturally in response to the research study? So it's really a very integrated look at the body of everything that you're putting in: supplement, food, water, poisons even. You know, how much poison and toxins are we allowing our bodies to be exposed to?
Yeah.
I think the best answer is they really want to get to the root of the problem. They understand that they're an entire person, and that not only do you have what's going on physically, but your emotions play a part into it. Your spiritual condition plays a part into it. Your mental condition plays a part into everything that's going on. So there's been times where, you know, I've referred people on for counseling because I can tell that, yes, we're dealing with the physical part, but their emotions are playing havoc with their body, and no matter how much nutrients we put in, they're being drained because of the emotional issues that are going on. And it's a balancing act of making sure that our body is working as a whole. And a lot of people get frustrated that you walk into a doctor's office and the average doctor takes 5 to 10 minutes, and they want your list of symptoms, and you walk out with 1 to 5 prescriptions. I take an hour and a half at my first appointment with each person. So I want to hear their story. I want to hear their symptoms. I want to hear their struggles. I want to hear their history. I want to hear everything that I possibly can, because no detail is unimportant to me.
Okay, so now that she's shared a little bit about what a naturopathic doctor does and is, we're kind of going to answer some myths around holistic medicine and the naturopathic doctor, because there's a lot of hesitancies, I feel, and a lot of fears. You know, people wanting to go see a naturopathic doctor, but they hear things on the street. So I'm gonna tell you the myth, and she's gonna tell me if it's true or false, and then answer it.
Okay.
So the first myth is naturopathic doctors are anti-hospital, anti-conventional doctor, and anti-conventional medicine.
Well, the short answer is, if I was, I would not be alive to this day. Our daughter was born at 27 weeks gestation due to me having severe preeclampsia. Now, after she was born, I dug into all of the root causes of why I got the preeclampsia, and working to balance my hormones, the lack of magnesium, the vitamin A deficiency, the possible lower fish oil, and the fact that my body requires higher levels. But if I hadn't have gone to the hospital, and if my husband hadn't been for that, I wouldn't be alive to this day, and we would not have a healthy, beautiful 2-year-old daughter.
Yeah.
So no, you will encounter some naturopaths who unfortunately put a blemish on the profession in general by being completely anti-doctor. But to me, there is a balancing act. There's a place for traditional medicine, and there's a place for natural medicine. And the most beautiful picture is when you have that balancing act and they're actually working together. For example, we have a local doctor who understands the benefit of herbs, and he writes prescriptions and he works with his patients, but he also refers them to us to get their supplements. And he understands that same thing for me. I'm not going to treat someone with a broken leg. Number one, I can't treat him, and number two, a broken leg, you need to go to the ER.
Yeah.
So it's truly about a balancing act and realizing that there may be a case where you need medication, and as a result, you may need it long-term or you may need it short-term until you can get your body supported. And that's really the question that a naturopath digs into, is how can I support the body to reduce the use of medication to only when needed. But there's that when needed. And another thing that's kind of nice is, as a naturopath, I can't take people off of their medication. I can tell them when, from a naturopathic perspective, they appear to be ready to have that conversation with their doctor of, can I come off of this medication? Can I try weaning down? But then I refer them back to their medical doctor. So it's a balancing act. There's a place for everything. It's just like there's a place for vegetables and there's a place for fruit. But if you only eat fruit, you're going to get sick.
Yeah.
And if you only eat vegetables, you aren't going to get protein that we get from our meat and our dairy. So you can apply the same example to naturopathic.
The next myth is naturopathic doctors all follow, believe, or integrate New Age theologies into their practice.
Absolutely not. There are a lot of strong Christian and Hebrew roots believers in the naturopath natural mentality. For me, I strongly believe that you're saved by faith. The Bible is the Word of God. And, there are certain things within the natural world that I'm very cautious of. So there are some companies who come out and present a very strong New Age philosophy, and I don't use their supplements. But it's just like if you had a bookstore. There's really good books out there, and there's really bad books out there. To throw the baby out with the bathwater is never a good idea. You can get into some more questionable areas in the natural world, but if you're working with a reputable naturopath that has a biblical background, they're going to do their best to steer you. And you can always research things to make sure, if you have a question in your spirit, you can always research things. For example, I'm not going to refer anybody to participate in yoga because it's meditation that introduces another religious philosophy into it. Things like acupuncture. There's a lot of people in the natural world that are very much into it. It actually interrupts the energy that God designed. So it's going against God's design. Some people are like, oh, homeopathy is very dangerous. No, homeopathy, when you understand the science of it, is an excellent thing, but it's just like anything else. People distort it. And
what is homeopathy? I don't even know.
Homeopathy is the understanding that everything has an energetic signature, and so it doesn't take a lot of something for you to get the effect. And also, sometimes if you're taking something that has the opposite effect on the body, it causes a healing reaction. So there's like 3 or 4 different thoughts that go into homeopathy. Homeopathy is not my strongest suit, just to be completely honest. I use a lot more supplements, but the nice thing about homeopathy is that you can use it if you're on prescription medications without worrying about interference. So that is an area that I have been doing more and more study because I think there's a lot of benefit we can get from that.
Yeah. So the last myth is naturopathic doctors push supplements to make money. Is that true or false?
No. Because if I push a supplement to make money, then I'm pushing a supplement for the wrong reason. And ultimately, you're not going to get the results that you want as a client, and it's not going to help you, and you're not going to be on the right path to get healthy, and you're not going to keep coming to me. So for me as a naturopath, and I'm not saying that there aren't doctors who push supplements, because it's just like anything. You have good doctors and you have bad doctors. But for me, it's about building a relationship. And it's about helping you to continue on your journey to health. I have patients who work with me and their traditional doctor and maybe a specialist. They've got a lot going on. And in fact, I had a client yesterday and she's like, well, you're kind of the center of my care because she had multiple complicated issues, and you're the one that brings all the different practitioners I see together to help me kind of balance all the different approaches and say, okay, I need to ask this doctor this question and this doctor this. So a lot of my patients, yes, they do buy supplements through our store, but that's not a requirement. I'm going to see you just because I want to help you and I want to educate you. That's really what a naturopath is someone who has a degree that really understands the body and understands what works with the body. And one of the things I tell my people when they come to see me is a naturopathic approach is like peeling an onion. So we're going to start out and we see all these layers at the top, the outer peels and things, and we're going to start dealing with those. But as we go, we may find a bad spot and something may surprise us. You may react to a supplement that we weren't expecting you to react to. So it's going to be a balancing act to find what works for your body, not what works for everybody.
Yeah.
And so, that's honestly why naturopaths charge, because it's just, as a doctor, you're paying us for our time, and then I can be objective in what I recommend.
Yeah, that makes sense.
So, and it's like I said, homeopathy was not something that was a huge push in naturopathy, because a naturopathic is primarily focusing on the nutrition and the supplements. But as I have continued to advance, that has been something that I realized, wait a minute, homeopathy really has a neat place in this. So I've been taking extra courses and doing extra study so that I'm more versed in that modality. Because within naturopathy, there's homeopathy, supplements, diet, hydrotherapy, essential oils, and probably 2 or 3 other specific modalities that I'm not mentioning. And it's really looking at the person as a whole and how can I use what works best for this person from each modality I have available.
Thank you so much for joining us. We hope you learned something and that you enjoyed the video. We definitely want to put out more of these, so we'll introduce another topic maybe next month.
Sounds good.
All right, so you want to share where people can find you, your websites?
Sure. So they can find us through the health food store, which is whitakersnaturalmarket.com. And then they can also find me personally at drjocelinwhitaker.com.
Okay, and both of those will be linked in the description box below, along with all my information. So be sure to hit that subscribe button. You can also head over to their Facebook page, which I'll also link below, and you can follow them there. So hope you all have a great day, and we'll see you next time.